Hello, my name is Marina Konopleva. I'm a professor in the Department of Leukemia at MD Anderson Cancer Center. I'll present for you today the lecture on targeting CD123 in other hematologic malignancies beyond BPDCN. CD123 is IL-3 receptor alpha subunit. It is found on early hematopoietic precursor cells and basophils, but it is most commonly overexpressed in a variety of hematologic malignancies. This includes BPDCN, which is universally expressed in nearly 100% of cases, AML, MDS, B-ALL, CML, hairy cell leukemia, and others. Thereby, the CD123 represents a potential target for novel therapeutic interventions. This slide represents CD123 overexpression in AML. By the work of Monica Guzman and Craig Jordan, it was shown that CD123 is highly expressed in blasts and also in CD34 positive stem cell of AML primary samples. CD123 expressed at low levels on the normal counterparts and high levels in CD123 positive AML stem cells, as shown you on the low right slide. In addition, CD123 was shown to be an excellent marker for the minimal residual disease. It is expressed in both AML and ALL and low expressly in normal progenitor cells. Additional work has suggested that high expression of CD123 is associated with poor outcomes in primary AML samples. In ALL, recent findings indicate that CD123 is highly expressed on both pH-positive ALL, pH-negative B-ALL, and at a low level on T-ALL. It is essentially not expressed on normal lymphocytes, as you can appreciate in the right upper panel. Using the anti-CD123 targeted strategies such as antibody-drug conjugate IMGN632, the normal lymphocytes were completely spared from the toxicity, while the conjugate induced targeting and toxicity against B-ALL blasts, suggesting potential therapeutic interventions. CD123, which is now targeted with the variable novel agents which are recently studied or undergoing clinical trials. This include antibody-drug conjugate SGN-CD123, which is currently halted as far as clinical trial. The ongoing trial is with the CD123 ADC IMGN632. There are also so-called dual affinity retargeting molecules or DARTs, which are CD123 CD3 molecules such as MGD006. And finally, there are bispecific antibodies such as XmAb CD3 CD123. This slide represents the structure of the CD123 CD3 bispecific antibody XmAb 14045. It contains the full-length immunoglobulin molecule, which is designed to be dosed intermittently in contrast to the smaller contrasts such as DARTs or BiTEs. It provides high levels of specificity against CD123 expressing cells. It has ablated Fc gamma receptor binding, which removes the potential of the ADC. The preliminary data presented at ASH 2018 have shown that this compound has activity in the relapsed refractory AML patients. In patients who were dosed at more than 1.3 microgram per kilogram dose level, the objective responses were achieved in 5 out of 18 patients, or 28%. In addition, stable disease was seen in additional 17% of patients, and reduction of marrow blasts in 56% of patients. This next molecule is CD123 CD3 bispecific DART protein, which is known as flotetuzumab. The DART allows optimal variable light and heavy chain pairing, which permits tighter conformation and closer proximity between CD3 positive affected T cells and target CD123 positive cells. It causes redirected T cell killing of CD123 positive target cells. The data which were presented at ASH last year showed that flotetuzumab in a dose escalation phase at a threshold dose of more than 500 nanogram per kilogram per day induced objective responses in primary refractory or relapsed refractory acute myeloid leukemia. From this, the objective response rate was 43% and CR rate was 28% amongst patients treated. Additional modality includes the ADC, such as IMGN632, which is a novel anti-CD123 antibody with high affinity binding to CD123. It has a novel DNA alkylating payload, the DGN549, which is very potent. It has additionally the stable peptide linker, which confers stability in circulation and can be released only intracellularly. The results presented at ASH last year showed that this compound likewise has activity in relapsed refractory AML setting, with the CR/CRi seen at 20% of the patients at all doses tested. Finally, the preclinical models have demonstrated the CAR T cells against CD123 can eliminate AML in xenograft models. This is the work from UPenn. In addition, the preliminary data with allogeneic CAR T, such as UCART123 from Cellectis, have shown significant reduction of the tumor burden and cures in preclinical models of AML PDX samples. In summary, CD123 or IL-3 receptor alpha subunit is commonly overexpressed in multiple hematologic malignancies. CD123 is expressed in residual disease AML cells and represents a stem cell marker. CD123 is currently being targeted with various novel agents, such as anti-CD123 antibody-drug conjugates, dual affinity retargeting molecules, bispecific antibodies, auto and allogeneic CAR T cells. I would like to thank you for listening to my presentations today.